Good morning, everyone, and welcome to our COVID-19 webinar series presented by the Denver Museum of Nature and Science, the Institute for Science and Policy, and our great partners from the Colorado School of Public Health. Thank you all for joining us. This is episode 23 that we've put on this year. I see many familiar names showing up in the chat. So thank you if you've been joining us throughout this whole series. If this is your first one, you are in for a treat today. And as Nicole was saying, if you joined us just a few minutes early, we're going to continue on this series into 2021. This has been really valuable, I think, to all of us and this partnership. And so if you would like us to think about covering a topic in 2021 as one of these episodes, go ahead and drop that in the chat. Maybe there's something you hear today, too, that you want us to explore in more detail. So we definitely want to hear from you. I know we've sent you a few surveys, but now that you're here live with us and you're focused on COVID-19 and how it's impacting you and your lives, definitely let us know what you want to hear in 2021. We try to make these timely, we try to make these relevant, we try to make them dive deep into certain topics, and so nothing is off limits as far as what you want to hear, and we want to make this very relevant and useful to you. So we have past recordings of all of our episodes. Just go to the Institute website. We also have written transcripts if watching the video recording is not your thing. I have absolutely found almost all of these episodes quite useful many, many months after we've even hosted them. As you are well aware of, today is a Wednesday morning at 8:30 a.m. Mountain Time, and we have chosen to move our series both for today and into 2021 to Wednesday mornings at 8:30. So if you have a standing calendar invite where you used to be joining us at Monday, please definitely move that to Wednesdays at 8:30. Again, at the bi-weekly cadence of every other week. We'll be focusing mostly, I think, on the second and fourth Wednesdays of the month. So today, it's all about reflecting on the year. Today is December 16th of 2020, and what a year this has been. It's been almost a year since the first confirmed case. It's been 9 months since major US response and shutdown, and it has been a year like none other in recent history. And so today we're going to spend some time reflecting on the year, both reflecting on our current situation as well as the history and our possible future. And we could not have found a better guest to join us today to spend a little bit of time reflecting on this, because he has already done that through writing a book, Apollo's Arrow. So I am very grateful to be joined today by Dr. Nicholas Christakis, the author of the new book, Apollo's Arrow, The Profound and Enduring Impact of Coronavirus on the Way We Live, joining me today. Good morning, Dr. Christakis. How are you today? Oh, check your mute. There you go.
Like, I rarely make that mistake anymore, but I still sometimes do. Anyway, good morning, Kristen.
It's such a pleasure to have you today. I'm going to do one little plug and introduce you, and then I want to give you the floor. So if you have not had a chance to read his book today, you are going to be in for a treat, because we're going to hear some highlights. But I also encourage you, if you want to support, the museum, the Denver Museum of Nature and Science, and of course the author, we do have copies of his book for sale in our museum shop, and you can buy them online through the museum shop or your local bookstore or wherever else you buy the book. I think Nicole at some point will drop in the link to the chat of at least our museum shop where you can buy the book. I highly recommend it. George Sparks is given this as like book of the year nod. We talked about it at our symposium a couple weeks ago. So Dr. Christakis is a social scientist and a physician who conducts research in the fields of network science, biological science, and behavior genetics. He directs the Human Nature Lab and is the co-director of the Yale Institute of Network Science and the Sterling Professor of Social and Natural Science at Yale University. In 2009, Christakis was named by Time magazine to their annual list of 100 most influential people in the world. Also in 2009 and in 2010, he was listed by Foreign Policy magazine in their annual list of top 100 global thinkers. His list of accomplishments is remarkable, absolutely remarkable, and I'm not doing him justice right now, but I think we'd love to spend time talking with him instead of talking about him. So let me relinquish the floor to him. He's going to give us a few minutes of just opening remarks, stage setting here on the coronavirus pandemics, and just a little bit about his book, and then we'll build on that for some further Q&A. So again, Nicholas, thank you for joining us today.
Thank you so much for having me, and thanks to all of you joining. I, of course, can't see your faces in this odd interaction that we have. In another life, I would have come to Denver, where I've been many times, and seen you in person. Um, Let me just try to set the stage by making a few remarks, as Kristen said, about the pandemic, because we happen to be alive at a moment when something very unusual has happened to us as a species. Namely, a new pathogen has been introduced into our midst. And this pathogen, this SARS-CoV-2 virus, is going to be with us forever. It's never going to go away. And in fact, we know at this point quite a bit about the pathogen. We know how lethal it is, something that wasn't so obvious from the very beginning. We now know that between 0.5 and 0.8% of the people who get infected with this pathogen will die. Now, that's not a trivial pathogen. That's at least 10 times deadlier than the flu. On the other hand, it could have been much worse. There's no God-given reason that this pathogen isn't much deadlier even than it is. We know, of course, that the likelihood of death varies with age, and in some sense, that's quite nice, actually, that the young tend to be spared. On the other hand, I don't think there's any reason for us to be nonchalant at the fact that people who are older are at greater risk of dying from this disease. If you look at this pathogen on this in terms of just its lethality compared to prior global pandemics or major diseases, for example, if you compare it to bubonic plague, which would kill 30, 50, in some cities, 80% of the people in the city would be wiped out within a couple of months from an epidemic of plague. Or you compare it to smallpox, for example, when introduced into Native American populations in our society here by the settlers, could sometimes wipe out 95% of the population, would be annihilated. Or to cholera epidemics or yellow fever epidemics, things that have stricken human beings for centuries. This pathogen isn't that bad, but it's still not trivial, I need to emphasize. We also know how infectious this pathogen is. Many listeners are now familiar with this notion of the R sub-zero, the R naught, popularized even in the movie Contagion, which actually is a quite realistic, almost, I would even say, movie describing our current predicament, except the pathogen in that movie was, probably killed 1 out of 3 people that it infected, compared to the one we're facing, which only kills about 1 out of 100. So anyway, so the infectiousness of this pathogen, we also know, and that's characterized by this R naught number, which is about 3. It's somewhere between 2.5 and 3.5. That means that the ability of the pathogen to infect new people, some intrinsic property of how spreadable it is, this known as the basic reproduction number, means that for each case in a non-immune population where the host is interacting normally, creates 3 new cases. If you take these two numbers, the lethality and the infectiousness, and plot them on a graph, and look at all the respiratory pandemics for the last 100 years, all the way back to the 1918 Spanish influenza pandemic, you can get a sense of how serious this disease is. Up in the upper right, the most lethal and the most infectious previous pathogen we know was the 1918 influenza pandemic, which led to a major global catastrophe. Previously, the second worst respiratory pandemic of the last 100 years was the 1957 influenza pandemic, which killed 110,000 Americans back then, which would be equal to about 220,000 today. And then you have all the other respiratory pandemics, including the 2009 H1N1 pandemic, which most of you don't remember because it wasn't so fatal. Many people got it, but it's down low here on the curve. The SARS-CoV-2 COVID-19 pandemic is the second worst respiratory pandemic we've had in 100 years. Worse than 1957, almost as bad as 1918, or not almost as bad, but in between the two. Before this pandemic is over, and it will take a year or 2 or 3 before it all sort of dies down in ways that we can talk about if you want, this germ will have killed at least 500,000 Americans and maybe as many as 1 million Americans. This is a catastrophe, okay? So former Treasury Secretary Larry Summers and a colleague of his, David Cutler, recently published a paper calling this the $16 trillion virus. From the moment this virus leapt to our species and arrived on our shores, it would do $8 trillion in economic damage and $8 trillion furthermore in damage in terms of our health, the deaths, the sicknesses, and the disability that will ensue from this pathogen. So our world has changed. It's very important for people to understand this. There's this new deadly pathogen that has been released into our midst, and it's had these dramatic effects. And these effects would have arisen despite, in some sense, what we did. In other words, I want people to understand that what's collapsing our economy is not our response to the virus so much, but the virus itself. It's not the government that's causing the economy to collapse through its actions. It's the virus. And if you go back hundreds of years and look at descriptions of plagues, even in medieval times, you would see that people talked about how the economy ceased when there was a deadly epidemic afoot. John of Ephesus, 1500 years ago, describing the plague of Justinian, talks about how everything slowed and ceased. The economy stopped. So something, a once in a century event has happened to us. And this virus, there's debate among scientists whether viruses are living things or not. But from my perspective, you can think of the virus as a living thing. It's having, what's known as an ecological release. It's found untouched territory, and it's exploiting it. And our bodies are the untouched territory for this virus. Our society is. It's just spreading and spreading, and will continue to spread forever. Now, I want to emphasize that this way that we have of living right now, which seems so unnatural and alien, is actually not new to our species. It's just new to us. We think that it's so weird and odd and unfair and unjust that we have to live this way. But what I want to emphasize is that people for centuries, for thousands of years, have been confronting this ancient threat. Plagues are in the Bible. They're at the opening of Homer's Iliad, which is Apollo's era, where the name comes from. They're in Shakespeare. They're in Cervantes. Plagues are not new to our species. They're just new to us. And so many of the things that we see, from the death of healthcare workers, for example, Thucydides in the Plague of Athens talks about how all the doctors were dying, to the blaming of others, to this feeling of grief and loneliness and fear. All of these phenomena that we are witnessing, these psychosocial and economic phenomena, have been described for hundreds of years. And I think it's very important for us to take that in if we're to really better confront, this enemy that we're now facing during our time in the crucible. And in fact, if anything, we're lucky, not only because this pathogen is less deadly than these other ancient threats, but also because we are the first generation of humans ever to be alive who could in real time invent a specific countermeasure to the disease. Up until now, we've been using primitive means to respond to this primitive threat, wearing masks, physical distancing, avoiding gatherings, closing schools and businesses, and so on, for example, which are tools that have been at our disposal for hundreds of years. Previous generations of humans have thought that they could use elaborate pharmaceutical treatments, rub yourself with dead snakes and onions, for example, as a treatment for the bubonic plague, but those treatments didn't actually work. We, on the other hand, have been able to invent a vaccine in 10 months, which is just astonishing. Now, the vaccine will help us a lot, but I want to emphasize that it's not a panacea, and it's not going to be anywhere near as quick as many people in the popular media are describing. Let me give you a short little description of how I think the pandemic is going to unfold for the next few years, and then I'll stop and we can open it up for questions. The vaccine, it's amazing that we've invented it, but it's going to take time to manufacture tens or hundreds of millions of doses, to distribute it, which is not an easy challenge for many of these vaccines, and perhaps most important, to persuade a majority of Americans to take the vaccine. We have to get to something known as the herd immunity threshold, which we can discuss later if you want, which for this pathogen is at least 50% of people need to be vaccinated before the epidemic force of the pathogen has been nullified. But meanwhile, while we're engaged in all those activities of manufacturing, distributing, and accepting the vaccine, the virus is still spreading. Right now, probably only 13 to 14% of Americans have been exposed to the virus. And so we're only about a fourth of the way to herd immunity, which is about 50% of the people. So my feeling is that either way, 2021 will be consumed with this pandemic. It won't be until the beginning of 2022 or the end of 2021 before we put the epidemiological and biological force of the epidemic behind us, when we reach herd immunity either artificially because enough people are vaccinated or naturally because enough people have acquired the infection. And then we're going to have a period of time, judging from previous pandemics and epidemics going back thousands of years, of recovering from the psychological, social, and economic impacts. Let's not forget, tens of millions of Americans are out of work. Millions of businesses have gone out of business. Millions of children have been denied schooling opportunities. Furthermore, we're also going to have millions of Americans that are disabled. Whereas between 500,000 and 1 million Americans are going to die, we don't know for sure yet, but perhaps 5 times as many will have some kind of long-term disability. I'm not talking about long COVID, people who have short course of disease or long course. I'm talking about people who, once they recover from the acute illness, still have some disability, pulmonary fibrosis, cardiac problems, renal insufficiency, neurological deficits. And those people might number perhaps 2.5 million Americans. So that will also have to be coped with. Plus all the aftershocks, the economic aftershocks. So my thinking is this gets us to about 2024 before we're finally able to put the social, economic, and psychological impact of the virus behind us. And then come 2024, I think we're going to have something like the roaring 20s of the 21st century, similar to the roaring 20s of the 20th century, which ensued after the 1918 pandemic. During times of pandemic, people get more religious. This is typical. People become more abstemious. They save their money. They don't spend money. They become risk averse and so on. But at the end of the pandemic, all of these things will reverse. I think people will relentlessly seek out social opportunities in nightclubs and restaurants, for example. No one will be wearing masks anymore by then. You know, in the next couple of years, people will still be wearing masks. We'll have intermittent school closures. People will be avoiding mass gatherings. But then, you know, that'll be the immediate period. Then there's the intermediate period. When we get into the post-pandemic period, you know, people will now have this pent-up demand for social interaction. So they'll relentlessly seek these out. We may see changes in sexual practices and, you know, some sexual licentiousness. We'll see spending. People will spend a lot of money having, you know, avoided spending. We'll see risk-taking and joie de vivre, and we may see an efflorescence of the arts. We'll see a lot of changes, I think, at that time. Now, I don't want to overdo the analogy to the 1918 Spanish influenza pandemic. Of course, that was confounded with the existence of the First World War. But I do think that, you know, people right now who are living in this very constrained way will experience this kind of release, you know, at some point, not too distant future. So I think that's just a few remarks I just wanted to make about, to sketch out some basic epidemiology, some basic historical framing, some simple forecasting about what's likely to happen. And I'm happy to talk to you now more generally about anything you're interested in with respect to this pandemic.
Thank you. I mean, that was a wonderful opening. And I will have to say, Nicholas, both in your opening and also having read the book, we all have our own little habits, right? When we get a book and we read the covers and we flip through it and whatever it is. And the first thing I did, of course, was open and look at your table of contents and your chapters. And I quickly realized when I finished the book that any chapter in and of itself could be a whole episode with us today. So we're going to touch on a few things in your book, a few things you just said there, which really is reflective of your book as well, too. So I'm excited to see where this conversation goes. I've got some questions of my own, and I know our audience will have a ton of questions as well, as they always do. But let me just start with something really kind of big and overarching and framing. As you know, you wrote this book in the middle of a pandemic, right? And so you bring a lot of unique perspectives and experiences to writing it. But I'm sure you've done, of course, a lot of research along the way as you were writing it. Was there something shocking to you as you were going about researching this book that maybe, you know, you weren't expecting when you were coming into approaching this topic of how do we frame this for our book?
I know I get that question sometimes, and it's always awkward for me because it makes me feel very immodest to say that no, I was not surprised. Perhaps it's because I've spent so much of my life, you know, studying contagions, you know, and
Yeah.
looked at the history of epidemic disease. I think, you know, from a broad sweep of history and from a basic understanding of epidemiology, there's very little that has been surprising. I mean, I like to tell people, you know, that we have done embarrassingly badly as a nation coping with this epidemic, especially given the fact that we have the CDC, which is the envy of the world. the CDC and the White House have for decades periodically released documents called, a national preparedness plan for pandemic influenza, for example. The pathogen's different now, but the planning and response would be basically the same. No experts have really been surprised by this. I mean, Tony Fauci was writing articles about respiratory pandemics when I was in elementary school. So, there's to people who had expert knowledge back in January, honestly, not much has happened that is surprising, except perhaps, honestly, from our incompetent response and perhaps from our the rapidity with which we've been able to develop the vaccine. But by the time I wrote the book, it was obvious to me that we would have a vaccine in the first quarter of 2021. We're a little early. It was approved in December, but not much earlier than I expected, honestly. I'll just say one other thing. Part of my motivation for writing the book was that I started working on this topic. In January, I was kind of paying attention to what was happening in China, not a lot, but I had these Chinese colleagues with whom I'd done some scientific research for the last 5 years, and they contacted me in middle of January to discuss doing some work related to coronavirus. And so I really was then paying attention. We were using phone data to track the movement of people through China in January into February, and thereby to track the intensity of the epidemic. And as a result of this, I was really paying attention. And as a result of that, when China around January 24th or 25th imposed its own lockdown, I became aware of the fact that the Chinese government on January the 25th required 930 million people to stay in their homes. So the Chinese judged the nature of this threat as sufficiently severe that they basically detonated a social nuclear weapon. 1 billion people were locked down in their homes before the end of January. And this really got my attention. I mean, and so I was very concerned that the American public was not mindful of this. Like, what were we thinking? On the other side of the planet, there are 1 billion people in their homes. Why on earth would we think we would be spared this fate? And it's in the nature of these pathogens that they just spread. It's very difficult to contain them. So anyway, so I guess I'm talking a lot, but my point is, I was very concerned. And in February, I thought we still weren't paying adequate attention. And so by March, I thought, what can I do to help? And I thought what I would do is honestly write this book. I mean, it sounds pathetic. I mean, how can a book help? I mean, it can't really. But I wanted to sort of try to help people to understand what was it that we were facing and would face. And so I sat down in the middle of March to write it, and I worked nonstop for 4 months, 120 days, and I delivered it to the editor in July, and it was, printed in August.
Wow. Well, that's impressive. And as someone who, as many of our audience have been tuning in, and myself who's been hosting this series, I found a lot of useful information in your book. So thank you for writing it. And so don't be modest in that regards. But let me pick up on a few things you just said there, particularly about our CDC, China, their initial response, and the idea of proactive versus reactive policies. And you write a little bit about that in the context of, closing down schools and other things to slow the spread. Here in the US, we've talked about it ourselves, and there's, a lot of focus on and criticism on our federal response to the coronavirus. I'm wondering, what would have been a better, more ideal federal response from your perspective, in helping to manage this pandemic earlier on, when you first were becoming aware of it earlier in 2020?
Well, I couldn't believe the things that the president of the United States was saying, because from my desk, it was obvious. And we now know, and I was very worried because end of January, I was very concerned, and most of the expert epidemiologists I was in contact with was very concerned, but we were getting these very fanciful statements from, high levels of the federal government. And I was like, this can't be possible. I mean, there's just no way that I'm more in the know than the president of the United States. That's an absurd statement. And then we now know that that was absurd. In fact, the president was briefed back in December about the likely pandemic potential of this disease, which is, of course, as it should be. He's the president of the United States. I mean, the NSA works for him, the CDC works for him. People, he should have better information than the average person on the street. So they knew what was happening. But for whatever reason, and we can speculate as to the reasons, they didn't take a proper action. And proper action would have included a number of things. First of all, it would have included manufacturing more PPE. The fact that we did not have enough supplies for our healthcare workers and for our citizens, to the point where Americans died alone, hundreds of thousands of Americans died alone. One of the reasons for which was that we didn't have PPE to spare to give their family members to come visit them in the hospital. We didn't have enough ventilators and other equipment. We didn't have testing built. We had successfully and rapidly done testing for respiratory pandemics for decades, but not in this case. There were a number of goofs. Even after the goofs were discovered, we were slovenly in our response. And most importantly, we weren't preparing the American people. And I think public health messaging is a crucial part of a public health response. It's very challenging. I know it's challenging because epidemic growth is difficult for people to understand. So exponential growth. So 1 becomes 2, becomes 4, becomes 8, becomes 16, and 32, and 64, and 128, and 256, and on. But it's slow at first, and nothing seems to be happening for a very long time. And then all of a sudden, a lot is happening. So it's very difficult for leaders to go out to the public and say, we know it seems to you that nothing is happening, but actually the situation is very serious. But see, that is the duty of leadership, especially during challenges of pandemic, to explain to people, look, I understand that you're not seeing people dying around you. I understand you can't see this virus. I understand it seems to you that these responses I'm recommending are extreme, but they're not. And especially since, and here's why, and especially even if we thought somehow we would escape the fate that occurred to China, Italy, let's not forget, Italy collapsed. A wealthy Western democracy collapsed in February. I mean, what were we thinking then? In March, people, politicians, not just at the White House, of course, in New York State and New York City and elsewhere, both right-wing and left-wing politicians, to be honest, although I hold the president to special account for this, were releasing very benign statements. They were endorsing things like, one of the arguments I make in the book is that the germ spreads through social networks from person to person, and right behind the germ trail denial and lies. And lies are a part, and denial are parts of epidemics going back hundreds of years. The president was saying that hydroxychloroquine would be a miracle drug. There was no evidence for that. No reputable science supported that belief. It was like a snake oil. And that's not a responsible thing to tell the public. So anyway, I'm long-winded right now, but the gist is we felt that despite our wealth, despite the openness of our society, which should have allowed for information to spread, and around the country you saw hospital systems that tried to stop doctors and nurses from talking, which is exactly the wrong thing to do, right? You're not going to beat the virus with denial and lies and silence. So despite our openness, despite our wealth, despite our scientists, despite our strengths, we did not capitalize on those, and in my view, have done poorly, and the price of that is death.
Yeah, and Nicholas, you can be long-winded all you want. This is absolutely fascinating. I'm gonna have to pick up on so many threads, but let me take the political response angle another level here, and we'll come back to messaging and communication. But throughout history, right, from the AIDS epidemic to the Spanish flu, has the political response differed, or has our political response always struggled in the face of massive pandemics like this?
It does. In fairness, our political response always does. I mean, we didn't do so great with the onset of HIV, and in part that's also because during times of plague, people don't want to believe this bad thing is happening. It's very tempting to blame others. During bubonic plague, it was anti-Semitism. The Jews were responsible. There was one poor case where in Italy, where 4 hapless Spaniards were in a city and they were blamed and they were tortured to death because they were thought to have been the bringers of the plague. During the HIV pandemic, men who have sex with men were blamed, or Haitians were blamed, or IV injection drug users were blamed, for example. At the beginning of this pandemic, there was a desire to blame the Chinese. Always there's this desire, you see, to blame someone else, which interferes with the capacity to forthrightly confront what's happening. But see, the problem is there were experts who were not just speaking the truth we know retroactively, even at the time, it was possible to discern that these were credible voices who could explain why they were saying what they were saying. Like earlier at this talk, I talked to you about the lethality and infectiousness and how if you just plot them, you could see how bad this was going to be. This is a classic paper that was published, I don't know, 20 years ago now, on how to plan for respiratory pandemics. So early on, you can get some assessment of these quantities, and then you put them on this graph, and you can see, is it a big one or not? Well, people had already done this back in February. It wasn't hard for experts to do this. So an expert could say, here's why I think it's going to be serious. Here's my evidence. And, what do you think? And we could have had a less ideological conversation about what was facing us, which I think would have made it easier for us. Now I meandered, so I lost track of your question. Did I answer your question?
You did. You started out thinking, you answered it shortly at the beginning, which is, we haven't always had a great political response to some of this. And I think you elaborated beautifully.
Because it's hard. Because in fact, it's hard to do. I mean, I have to be honest that it is hard. And but there are, let's also be honest, there are countries that have done much better than us. Now, of course, there are the rich island nations, Taiwan, New Zealand, South Korea, which is basically an island because the border with North Korea is closed, which have done well. They've been assisted by the fact that they are islands, but other islands like Iceland did not do so well. So that wasn't the only factor. And even Greece, poor little Greece did really well at the beginning and still is doing okay. Germany did well. Some other countries did well. And, I'm an American, I'm proud of our country. I want us to do well in confronting this. I don't want my fellow citizens to die. And I see these deaths as not, let's be clear, some deaths were unavoidable, but I think we've had needless deaths and more than we should have. And so I think we could have done better. And I still think we need to do better. I need to emphasize to listeners that if anything, the imminent arrival of widespread vaccination, by imminent, I mean within a year, should increase our resolve to behave well, because there is a light at the end of the tunnel.
So one thing we haven't, death has been underlying to so many conversations this year that we've had, but we actually haven't spoken a lot about death and dying and grieving. And I don't know if our audience knows this, but you are a hospice physician, or were a hospice physician. And so there's a psychological aspect, of course, to this pandemic, which is huge when it comes to grief and death and dying, and how people approach that. And it's quite complicated. So I'm wondering, through that lens of that own personal experience that you have of working in hospice, how has that shaped your perspective in our current situation?
Well, I think, there's a famous saying I think Rudolf Virchow said this, that there's nothing human is alien to a doctor or strange to a doctor. I mean, I think if you're a good doctor, you acquire a kind of reverent, gentle appreciation for our frailty. And if you're a hospice doctor and you see death up close a lot, it highlights for you our common humanity and our vulnerability, actually. And you acquire certain commitments to the proper care of patients near the end of life. And this is one of the reasons that my blood was boiling when people were dying alone, in March, and our hospitals were closed down. I mentioned the lack of PPE, but that wasn't the only reason. It was the inundation of our hospitals that also contributed to the problem. A well-functioning hospital, of course, can make arrangements for loved ones to be with the decedent, right? Or the terminally ill person, because the nurses are not exhausted, the rooms aren't packed, there are not people in the hallway. When there's an epidemic afoot, one of the reasons you don't let family in is you don't want them to acquire infections from other people in the hospital and therefore create more cases. And you also don't want them to bring infections in and infect more people. So, but this is all made worse by the fact that you don't have PPE and the hospital is packed to the gills. And so people are prioritizing their, caring for patients over having good deaths, let's say. But all of this could be avoided if we do our part to flatten the curve, to reduce the intensity of the epidemic at any given moment, so our doctors and nurses can do their jobs more effectively, and our first responders. And so I think as a hospice doctor who had put so much emphasis and subscribed to the philosophy that we take good care of the dying, to see what was happening in our rich country in 2021, was anathema, honestly. So it was blood boiling. And then to see that we're repeating that, like, we're fools. We're just fools that we have not properly prepared. And I need to emphasize, it's not just the healthcare systems that need to prepare. The citizenry needs to prepare. I mean, people need to understand why, for example, when the epidemic, now struck China, Wuhan collapsed. The healthcare system was overwhelmed. The Chinese had to build a 1,000-bed hospital in 10 days. They built a 1,000-bed hospital with 10 ICUs or 20. I don't even remember how many ICUs in the hospital they built in 10 days. You could see the time-lapse photography. And then Lombardy collapsed in Italy in February. And then New York City collapsed. And now we see other parts of the United States, their healthcare systems collapsing, and people are shocked and surprised. Why? I mean, what makes any city think that they're special? And do you really want that for your city? Would you not prefer to do your part, avoid crowds, wear your mask, do basic things, engage in physical distancing, get testing when you can, obey quarantine guidelines, minimize your shopping trips, instead of going out whenever you want, go out once a week to buy your supplies, do all of these basic things to thin out social interactions so that those among us who get sick can be properly cared for. And if, heaven forbid, they are dying, they can be visited by their families. Anyway, another long-winded response, but, just very emotional for me to see this.
Yeah, no, I appreciate you sharing. Thank you. And you had wrote this in the book, and I had written this down, that also truth was another casualty of this plague, and the idea of misinformation or truth in our society. A lot of our audience is always often interested in understanding how to communicate facts to resonate with people. I'm wondering if you could just elaborate on that concept and that idea of you wrote as truth being another casualty of this plague.
Yeah, so I think that's a famous saying about warfare, right?
Yes.
Truth is the first casualty of war. I think truth is a casualty of plagues as well. And as I discuss in the book, there are many. It happens a lot. I think for public figures, just starting with public figures, I think communicating factual knowledge, explaining the basis. So say, here's what I think is the case. Here's why I think it. Here's my evidence for this belief. And here's my degree of certainty or uncertainty. And then also owning your mistakes. So for example, if 2 months from now you say, 2 months ago, I told you this for these reasons, and I did tell you I wasn't 100% sure. And now I'm back to tell you that, in fact, I was wrong about that. Here's what I know now. And here's the reason I've changed my opinion. That can enhance credibility. And as we alluded to earlier, is an enormously important part of responding to a pandemic is public health messaging and credibility. I think we could have like beloved figures, like Tom Hanks or Dolly Parton or Linda Ronstadt, or people who the public sees favorably, who could play a role actually in helping people to kind of say, okay, this is serious, we got to take it seriously, we should be vaccinated, we should do whatever we're doing, let alone scientists like Tony Fauci and so on. Now, in your everyday interactions with other people who hold beliefs that are plainly false, there's wonderful tools that Jonathan Haidt, the social psychologist, has described for how to do this. It's not easy, but at a minimum, I think there's an old saying, you can't reason a man out of a position he hasn't been reasoned into. So people who hold beliefs that are unreasonable, it's not facts that they need, it's an emotional connection. So you have to first join them. Why are they saying this? Maybe they're afraid. So they're denying the existence of the plague because to accept the existence of the plague would mean that they have to accept the legitimacy of their having lost their job. And losing your job is a devastating consequence for an adult. People don't want to lose their jobs. And so rather than having to engage with that topic, they say, well, it's all bogus, it's a hoax. There's no plague, something like that. So first you have to engage them where they're at emotionally. And then you have to look for points of agreement. Okay, what do we agree about? We do agree people are dying. Maybe there's a debate about how many are dying. Would you like to talk about that? Or, you look for points of agreement with your interlocutor. And then you finally, so first is you connect on an emotional level. Second is you look for points of agreement. And the third is you recognize it's not a one-off conversation. It's a sustained interaction that slowly chips away at people's, beliefs.
Right. It's Tamar Haspel spoke at an event of ours last year, and her takeaway was facts don't persuade people, people persuade people.
Yes.
And be persuadable. So we are coming up on our time, but I do want to give you a couple more reflections to hopefully wrap up on. One of them, of course, is this idea of change, right? And we're all seeing change in various aspects, whether that's technological or personal and social. So I'd be curious, do you have any thoughts on changes that you've seen and witnessed that you think are going to stay with us after this pandemic is over? Right? You were talking about, roaring back and the 2022 to 2023 and 2024 time horizons. But I'm curious, from your mind, what changes have you seen that you think are going to endure?
Well, I mean, first of all, one of my toy examples of this from the 1918 pandemic, which is Spittoons. In the 1918 pandemic, actually in the turn of the last century, already people were really concerned about public spitting because of tuberculosis outbreaks. And so there were big moves afoot to get people to stop spitting in public. And in those days, many restaurants or saloons, like you see in a Western, would have spittoons in them. Well, when the 1918 pandemic struck, I mean, the impetus to stop public spitting was really heightened, and all the spittoons were removed from restaurants, these big brass buckets of spit, Well, they did not come back after the pandemic. I've never in my life been to a restaurant that had a spittoon, nor have I ever met anyone who said, it really is awful that we don't have spittoons anymore. I can't believe they got rid of them 100 years ago. That was a change, it's just a permanent change in our society. That's a toy example of the fact that certain things might change in our society in ways that we don't even remember. Another example that many listeners my age will remember, not related to epidemics, is smoking sections of airplanes. Even as a child, I remembered how odd it was that the smokers were way in the back because, of course, the smoke could come to the front. I didn't really understand. Now nobody asks, why isn't there a smoking section on this plane? So there's certain things like that, little things that may change. For example, our tolerance for these types of Zoom meetings, for example, working from home. I think business travel is going to be different. Many people have made these observations. But there are also some other things that might be a little bit more subtle that aren't so obviously, people aren't so aware of, maybe impacts of the epidemic. Let me give you one example. So in this country still, it is typical that most couples are heterosexual couples. Of course, there are homosexual couples. There are single head of household, single mother, single father households. Let's for the moment consider the stereotypic heterosexual couple. And it's still stereotypically the case, it's not always the case, that men make more money than women in the labor market. That is not true for all households, but for most households, that's true. And furthermore, it's also stereotypically the case that women have a higher interest in, perhaps I would say tolerance for, taking care of young children than men. That's not always the case, but that stereotype is empirically true. So now let's consider such a stereotypic heterosexual couple. Man makes more money than the woman. Woman is more interested in taking care of the kids, of which there are tens of millions in this country. And such a couple now is sitting around their kitchen table, and the epidemic has hit. The labor market is collapsing. People are losing their jobs. Schools are closing. They're deciding what to do that's best for their family. And so they decide, for example, that the husband should continue to participate in the labor market because his wages were higher than the wife's. Plus, the wife is more interested in spending time with the children than the husband might be. And they're totally entitled to make this decision. It's their family. They're choosing what's best for their family, and they make this choice for themselves. But meanwhile, millions of other families maybe are making the same choice. And as a result, we may see a regression, a loss of 10 to 20 years of progress in women's labor market participation because of this. At the other side of the pandemic, in 5 years, we may see that women are less prevalent in many occupations. We may see greater wage inequality. We may see all these socioeconomic ripples in the gender dynamics of the economy because of a germ, you see? So this is another kind of thing, another way in which, for example, the virus may reshape our society, not like a little physical thing, like whether we shake hands, for example, or how many people still wear masks in 5 years. And there will be such people who say, wait a minute, I wore a mask for a couple of years and I didn't get any infections, so I'm going to keep wearing a mask, like you see in many Asian countries, for example. So there'll be changes like that, but there may be other broader changes. Plus, of course, inflation, and because we're borrowing against the future right now, basically printing money, all kinds of other things that may change macroeconomically and macro sociologically because of a virus.
Yeah. Oh, I could speak with you all day. We are coming up on our time, so I want to give you one final word and reflection for our audience, which is, there's been a lot of, the worst in us and the best in us. I'm assuming that's society in general, but I think it's maybe come to a head in the middle of a pandemic. I do want to focus on the best of us for your closing thought. Any sort of silver lining or best of us thought
Well,
that you're taking out of this year?
I mean, I love human beings and I love our species. And my prior book was called Blueprint, The Evolutionary Origins of a Good Society, which tells you everything you need to know about my feeling about who we are. And so I see a tremendous good in human beings, and I see tremendous good in our society. And it is absolutely the case as well that the way in which we are going to beat the virus is by exploiting some of these good qualities, our ability to cooperate and share information and work together. And we've seen that scientists around the world collaborating and volunteers volunteering for to be in the trials of the drugs, and people contributing to soup kitchens and even working together to live apart, right? Collaborating to do the things we need to do. So honestly, I find more to admire in human beings than to despise in them, and I see a lot of evidence for that as well, and even in this modern plague.
Thank you. I echo that sentiment. I want to say just a huge thank you on behalf, of course, Dean Samet, John Samet, our dear friend and partner in this, all of my colleagues at the museum and the Institute for Science and Policy. A huge thank you for your time this morning, for spending this and reflecting with us on this year. It's been a very emotional, trying year for many of us in many ways. And I think you really wrapped us up nicely. A huge thank you to our audience today. Nicholas, you may have noticed, but you often don't have to look at the chat because it gets so busy. Our audience is a really thoughtful, engaged audience. They have so many questions. So I always like to end or start on thanking them for their feedback and questions along the way, and apologizing that we do not get to answer every single question that comes through. But we love to see them. And as Nicole mentioned at the beginning, we use both your questions and then any ideas you have on themes so that we can continue to structure this series so that it's useful for you. And we will continue on into 2021. Our next episode will be on Wednesday, January 13th at 8:30 a.m. Mountain Time. Make sure you're on our mailing list to stay up to date on all of that. Thank you, Nicholas, so much for joining us today. It was an absolute pleasure getting to meet and speak with you.
Thank you so much. Have a good morning, everyone.
Thank you, everyone. And I hope you have a wonderful, safe, and restful rest of your holiday season. Have a good afternoon as well. Thank you.